Good morning, everybody. Welcome to another online Zoom webinar brought to you by the National Institute for Occupational Health. And this particular webinar is in the format of a panel discussion. It is part of the Nedlac and NIOH management of OHS COVID-19 workplace training program, that is Occupational Health and Safety and COVID-19 workplace training program. This particular panel discussion / webinar is focusing on occupational health and safety COVID-19 policy updates, looking broadly at the regulatory framework, and then also looking at a particular item, the code of practice that has emerged in 2020, early in 2020. And without further delay, I will be introducing you to our panel members. Later on, I'm going to hand over to Dr. Graham Chin, who's going to just do the welcome for the National Institute of Occupational Health's Executive Director, Dr. Spoor Galamona, who's unfortunately been called to a very urgent obligation and another commitment. I hand over to you, Graham, if you could unmute. Over to you.
Thank you, Ashraf, and good morning and welcome to all past participants and hopefully many more new participants to this webinar hosted by the National Institute for Occupational Health, or the NIOH, more commonly known as NIO. So as Ashraf pointed out, I'm not Dr. Spoor Galamona and I'm not the Executive Director of NIO. My name is Graham Chin. I'm an occupational medicine practitioner. I'm working for NIO and servicing the National Health Laboratory Service, the NHLS. So once again, as Ashraf also indicated, unfortunately, Dr. Galamona, the Executive Director of NIO, was wanting to open this exciting webinar, but unfortunately is unable to. She's been called in, and has to attend to some other pressing and competing priorities. So the honor of opening this webinar and welcoming everybody was given to myself. Okay, so today's webinar is one of a series that will be delivered in the next upcoming months, and it's really aimed at assisting workers and workplaces to really try and apply the nuts and bolts when it comes to occupational health and safety. And for those that attended NIO webinars in the past, you'll find this webinar deviating slightly from our more theoretical directed presentation type delivery methods to one of a more practical directed focused area. And it's from questions NIO receives, often from workplaces and participants like yourselves. So granted, we will not be able to cover everything, every topic, but the intention is to highlight and perhaps direct all workers and workplaces to certain and specific aspects when implementing occupational health and safety. Yes, we all come from different industries. We have different sized organizations, different resources and abilities to implement OHS, etc. But it's hoped that webinars like today's one will always provide either a starting point to deliver OHS services and maybe make it healthier and safer, and that's our common goal. Or perhaps to those people that have established OHS services to continue to inspire you all to continue driving occupational health and safety, because we can see how important these elements have become in our daily living. So COVID-19 may seem like quite a distant memory now, and I think many people are fatigued, but it helps give us a starting point and almost a springboard to illustrate and drive some very important aspects of occupational health and safety in workplaces. And because it's become such a familiar term in households, communities, and certainly in workplaces. Okay, so hopefully each participant who views this webinar will be able to take back one, if not many more important health and safety messages back to their workplaces. And lastly, just from my side, I'd really like to thank all the people who make these webinars possible. For example, our experts like Ms. Huna and Dr. Lepere, today our technical experts, and other partners like Nedlac, the Compensation Fund, and all the staff and the background support contributors who make these things run very smoothly, sometimes under very challenging conditions. So welcome to all. I hope you enjoy it. I hope you gain benefit. And thank you, Ashraf. Over to you. And yeah, you can take it from here.
Thank you very much. That was Dr. Graham Chin on behalf of Dr. Spo Khalamono, the Executive Director of the National Institute for Occupational Health, NIO. And as he mentioned, we are very happy and pleased to be partnering with the Nedlac structures, in particular the Executive Director there, Ms. Lisa Seftel, and her colleagues. I'm now going to introduce you the panel discussion, and our panelists are Ms. Bulelwa Huna, who's a Senior Specialist in Occupational Health and Hygiene from the Department of Employment and Labor. You've seen the more detailed slides in the pre-webinar video on who she is and her background and the expertise she brings to our panel discussion today. I'm going to ask her to just open her video as well. The second person who you see on the screen is Dr. Jan Naper, who've just returned from an out-of-country commitment, and we are very thankful that he could move straight into joining us in this particular webinar. And the two broad topics we want to cover in our panel discussion is the regulatory framework, as I've mentioned, for occupational health and safety and COVID-19 in the workplace, and then the code of practice. And I'm going to ask Dr. Lapere to particularly focus maybe as his introductory remarks on what is the code of practice before I ask Ms. Huna just to get into the regulatory framework questions. And the code of practice, obviously the importance of managing exposure to SARS-CoV-2 in the workplace. And this was put out formally in 2022. And I think it was a process managed through the Nedlac structures. The practical application of that is very important. So perhaps, Dr. Peer, a minute on your side. What is the code of practice before we go to the broader regulatory framework?
Thank you, Ashraf, and thank you for having me. I'm in South Africa, not like Graham from space. The code of practice has to be considered a standard on how to deal with a specific hazardous biological agent. The Occupational Health and Safety Act is the wide framework on health and safety duties for employers and employees. It's detailed in the hazards on biological agents in a specific regulation. And then where one goes into specific detail on dealing with SARS-CoV-2 in the workplace, the code of practice gives you the manual. It's really a recipe from the U magazine, how to deal with SARS-CoV-2 in the workplace, Ashraf.
Thank you very much for that brief and short introduction. Ms. Bulelwa, if I could ask you the sort of first question in terms of the broader regulatory framework, if I can just quickly juggle my screens here for a moment. So is there still a need, for example, in terms of the occupational health and safety broader framework, as well as, you know, COVID-19 specific provisions, for example, to wear a mask in the workplace? Bulelwa?
Thanks, Ashraf. When you look at Section 8(2)(d) of the Occupational Health and Safety Act, it requires the employer to establish hazards and precautionary measures to any work that needs to be done. That's a very broad statement. So you cannot really say as the department that masks are still a requirement. When you read the Act with the regulations for as biological agents, as well as the code of practice that Dr. Jan Lapere referred to, the risk assessment will determine the control measures that need to be put in place. Because mask wearing is one of the non-pharmaceutical interventions that have been used. If in terms of the risk assessment, it is still a requirement based on what the employer has identified in consultation with the worker representatives, then that will be one of the control measures that need to be put in place. But one needs to be borne in mind that the hierarchy of controls need to be put in place. There must be ventilation requirements that are adhered to, issues of space requirements and so forth, so people are not clubbed together in one space. Because remember, except for SARS-CoV-2, which is still a biological agent and will remain a biological agent, there are other respiratory diseases that need to be taken into consideration. So the control measures will not really differ. So meaning that ventilation is still a key requirement. all the non-pharmaceutical interventions that have been put in place, they are still a requirement. So the employer needs to check now, in terms of the controls that were put in place during when we're in hard lockdown, what is still applicable in terms of what I have in my exposure. Because one also need to take into mind that workplaces differ. There are workplaces that intentionally work with biological agents, that is SARS-CoV-2. The requirements will differ from there. And then for the general workplaces, your shops and everything, office environment, their requirements will differ. So it's going to be difficult to say that mask wearing is still a requirement. The bottom line is the results of the risk assessment will determine what needs to be put in place. And also a person's individual responsibility also comes into play. If an individual feels that even if the risk assessment results say that I do not need to wear a mask where I am working, if me as an individual, I still feel needs that I must wear that mask, then you take that personal responsibility, because you still have a responsibility to take care of yourself, especially if you know that you might be having some symptoms and some people are not really disclosing.
Thank you very much. Maybe a linked question to that. I'm not sure if you want to add anything to that, Dr. Lapierre, but a linked question to that. Is COVID-19 in the workplace still relevant?
Thank you, Ashraf. If I may just comment on what Bulelwa was saying. Some of the world's health professions councils make it compulsory, ethically compulsory, for medical personnel still to use respiratory protection during their work. And in fact, I was reading the Belgian one, which says even in the waiting room. To reply to your question, is COVID still relevant? I think, first of all, the epidemic isn't really over. President Biden might think it's over, but the epidemic isn't over. We can all easily Google international figures, even South African figures. There's still a lot of people that are currently ill with COVID. There are still daily people dying from COVID. So the virus certainly isn't gone and isn't about to go. When you look at this from a pure occupational point of view, from a pure medical legal point of view in the workplace, we are still bound by two very important pieces of legislation. And the one is that COVID-19 is a notifiable health condition, which means that currently the South African legislation prescribes how to deal with suspected cases, prescribes testing protocols, reporting protocols, isolation protocols, and management protocols. So that all still is in place. A lot of people in South Africa think this is over. It's not over. That has been right from 2020 from the start, and that's still around. So if you have a symptomatic person in the workplace, there's a code to follow how to deal with this. And then secondly, regardless of what I said just now, that the Occupational Health and Safety Act and hazardous biological agents regulations determine how an employer must deal with COVID-19, there is the additional code of practice requirements which employers have to comply with. So yes, it remains relevant from a medical legal point of view and from an occupational labor legislation point of view, Ashraf.
Thank you for that. So quite clearly, being focused and on the ball with regard to our COVID-19 experience over the last 2 years and more would certainly strengthen our overall occupational health and safety systems within the workplace. Bulelwa, on the question of, if I can just get myself sorted here, what should a workplace risk assessment consider? You've touched on some of these elements, but if you could just give us, in a minute or two, some greater detail of why this is important and who are the key role players that must play an important role in such risk assessments to ensure that workplaces do this as regularly as required. Bulelwa?
Thanks, Ashraf. First of all, we do not prescribe a format for a risk assessment. So I will touch on the key aspects that needs to be addressed in any risk assessment that is put forward in that particular workplace. When we look at the role players, worker representatives play a key role. So the employer cannot wake up today and decide this is how the risk assessment is going to look like. There must be that consultation process with the worker representatives. And the health and safety representatives also have got a role to play. And also the cognate disciplines, people like Dr. Lapierre will give an input because they'll come from an occupational health perspective. Then you will have your safety professionals that will give an input. Then you will have also occupational hygiene professionals that will give an input. Even your HR people will give an input, because depending on what has been identified, each and every cognate discipline representative has got an input to give in terms of the solutions that are being put forward. So when you look at the aspects that need to be considered now, in any particular environment, it doesn't matter where it is, the target audience, we can call it that, or the group of workers need to be considered, those that will be working, the type of work that is being done, that particular.
Okay, I think your audio might
needs to be
go ahead.
Can you hear me now?
Yes, proceed. 30 seconds.
Okay, so in terms of the target audience, even the workers and the people that may come in terms of Section 9 that may be affected, that will need to be considered. And then now, in terms of what has been identified, there must be a characterization process that gets put into place. Then it will determine which are your high, medium, or low risks that need to be put in place, because that will inform the action plan that the employer will put in place. And then following the hierarchy of controls, then they will determine what to put in place, or they can use a combination of controls, like your ventilation system requirements, using also your NPIs, also administrative controls in terms of the rotation of people and so forth. That's why HR policies will come into play. That's why we also need the HR people, because it's going to affect now people in terms of how they work and the policies of that particular environment.
Thank you, Brother. Just a quick question I'm bringing from Doreen Smits. She asked, what are the regulatory framework requirements for the above risk assessments? And quite clearly, as mentioned by our panelists, and I speak under correction, they can correct me, it's particularly the biological hazardous agents regulations under the Occupational Health and Safety Act that will guide you in the workplace and all of those responsible to implement that risk assessment. Over to you, Doc. Should we not manage the infection? This is obviously SARS-CoV-2 or COVID-19, as we are commonly calling it. Should we not manage the infection in the same way as colds and flus? Doc?
Thank you, Ashraf. Is it all right for me to just go back on that risk assessment?
Please do.
I would like to identify 5 different hazards, not just the health hazards of SARS-CoV-2, which is obviously the illness and the acute illness and the long COVID, but also the employee's individual social hazard. Illness and sick absence might not always be paid. There might be severe illness in the family. People might have to work from home. A third aspect would be employee financial hazard. There can be unpaid absence, there can be reduced working hours, there can be no work, no pay events. The fourth one is the employer financial hazard in dealing with the controls of COVID-19. And then the last one is a psychosocial hazard, which I think has probably done just as much damage as COVID-19, which is COVID-19 fatigue, burnout, working from home, polarization due to mandatory vaccination, polarization to people not being vaccinated, and then allowing non-vaccinated employees to mix with others. So I think it's a much wider risk assessment. And then I identify essentially 10 steps in the risk assessment. If I may, Ashraf, just shortly mention them. One is legal requirement to have a competent risk assessor. Every safety officer worth her salt listening here, every occupational medical practitioner, occupational health nursing practitioner should be able to be that competent person. Number 2 is identify the hazards. I just went through the 5 different forms of hazards that I would suggest are being assessed. Then number 3 is what are the hazardous events? So what actually is causing these hazards to occur in my workplace? Number 4 is what Bulelwa said, assess the risk probability and severity and get to a risk score as to where to put this onto the management protocol. Number 5 is how do you prevent this hazard in the workplace, for instance, working from home, vaccination. Number 6 is the engineering controls, as Bulelwa says, ventilation, screens, that kind of things. Number 7 is the administrative controls, such as workplace organization, access control, social distance, sanitation, dealing with vulnerable employees. Number 8 is how are these controls now reducing the risk? So I'm now consolidating my original raw risk and reassessing the probability and the severity into what I consider now to be the residual risk. And then also in that step 8 is for somebody to stick their head out and say, this is an acceptable risk, I can work with this. Number 9 is an overall thing that all of this has to happen with the people who know best, and that's the employees. So there must be consultation with the employees and with the employees' cohorts. There must also be consultation during the implementation, the inspection, and the measurement. And then number 10 is to have a regular risk review. Ashraf, if I may now go back to the question that you asked me, couldn't we treat this as a normal cold and a flu? The risk posed by COVID-19 is not the same like influenza. It spreads more easily, and we've got this long COVID, which is unique, not applicable to flu. And for those people who suffer from it, it's an actual disaster. The current management requirements in occupational setting are not onerous, and they align mostly with good occupational health practices. So really, this code of practice doesn't bring something extraordinary to the workplace. It really falls into good occupational health practices. Obviously, the notifiable disease designation is something that government should be looking at, because it's really, if it's done properly, which I excuse to say so, but currently isn't really the case, but if it's done properly, adds a considerable amount of administrative strain to the workplace, to the healthcare system in particular. So to my opinion, and this is my opinion, this is not law and not fact. From an occupational health point of view, we could remove the notifiable disease designation. We could relocate the disease management to good clinical practice and let the professionals rule. We could accept that COVID-19 is an occupational biological risk and must be dragged along with those other risks. You know, there's many of them. There's Legionella in many places. As Bulelwa was saying, there are clinical practices where other biological agents act. And the only risk that we take with this proposal is the possible development of further variants, Ashraf.
Thank you very much, Dr. Lapierre. Bulelwa, just before I go to a question for you, Lungile Gasana has asked, can the Department of Employment and Labour, and they had shifted, I found it, prescribe a format for the risk assessment? My sense is clearly the department, as you indicated earlier, is not going to prescribe a specific format, and that in consultation with the occupational medicine and occupational health practitioners that support them in the workplace, health and safety consultants, they will probably be able to get that sort of guidance. A quick question then to you, Bulelwa. You have touched briefly on the sort of role of, I think, employers and employees, and clearly there are others like occupational medicine practitioners, etc. Now, in terms of the improvement of the occupational health and safety systems and dealing with biological hazards, what can the role players, particularly employees and employers, do for them to make sure that their own working environments and these risk assessments are in place, their own working environments are in fact safe for them to continue work? Bulelwa?
Sorry, Ashraf, I got frozen a bit. Can you repeat? I couldn't hear.
Yes, so in essence, what is the take-home key message that you have for our audience about the role of employers and employees and other role players within the health and safety system to ensure the workplace is safe and that we deal with biological hazards in the workplace? Over to you.
Okay, thanks, Ashraf. I'll go back for a second to down memory lane. In June 2019, just 9 months before the birth of COVID in our country, there was when the ILO celebrated its centenary, all the constituencies declared that occupational health and safety is fundamental to decent work. And that is linked to our Bill of Rights in the Constitution, and that is linked to Section 8 in terms of the OSH Act, where the employer is required to provide safe systems of work. In 2022, this year, a decision has been made now that OSH is a fundamental right, meaning that all the parties, even the workers, they've got a role to play to take care of themselves. It is not only a legislative requirement, it is an ethical and moral responsibility that you as a worker, you play a role in making sure that where you are working it is safe, and you've got a right to report to the department if there are no systems that are put in place, or what has been identified in the risk assessment as control measure is not being implemented, because that risk assessment is a legal document. So except what the employer has put in place, you also have a responsibility to comply what is put in place, and also observe that those precautionary measures, that they are properly implemented. Thank you.
Thanks, Bulelwa. A quick follow-up, Bulelwa, in a minute. And how do we ensure compliance? You know, how does the regulatory framework and the sort of monitoring and enforcement agency or regulatory agency like the Department of Employment and Labour ensure that there's compliance in the workplace? About a minute on that, Bulelwa.
Yes, our inspectors, they conduct inspections. We've got what we call proactive and reactive inspections. Proactive, they will identify where they will have to go for inspections. For a reactive, can be based on a complaint that was brought in by any interested or affected party. So when they visit that particular work environment, they will check on that particular risk assessment, including other legal appointments that must be in place, training that must be provided, medical surveillance program that must be in place, and also do a matching exercise with the risk assessment. Then they'll also do a walkthrough in the plant just to make sure that that was not just a paper exercise. What is identified and put in that paper is also being implemented in the plant, and they will interview workers. If there are non-compliances noted, and then they will serve the relevant notices to the employer representative.
Thank you very much. Doc, on the question of, you've touched obviously on the key aspects of health risk assessment in the workplace, that 10 key points you shared with us, which is very useful in our workplaces to assist us. On legal requirements and good governance requirements, what are the key messages you have for our audience to ensure that in the workplaces, the health and safety systems are robust and can deal with, you know, any biological hazard, in particular, including COVID-19? Over to you, Doc.
Okay, Ashraf, we essentially got 7 pillars of legal requirement left. One is COVID risk assessment and COVID plan that must be in place. 2, a management structure for vulnerable workers must be in place. Number 3, there must be some form of COVID-19 workplace access control to the workplace for people who may be infected, and that can be Section 8 employee or Section 9 people who are not employees. Number 4 is ventilation requirements. 10 to 12 liters of fresh air per person per second is what must be there to have the proper ventilation. Number 5 is COVID-19 communication to workers. There's a prescribed communication protocol. Number 6 is case management. We must still identify work-acquired COVID-19. And number 7 is workers' duties that are defined in the code of practice. If I bring this to good governance requirements, I have a few more. I've actually got 15. Number 1 is the COVID risk assessment and plan. Number 2 is a COVID policy on vaccination, even if you don't require vaccination. If you require vaccination, there must be a COVID policy on refusal of vaccination. Then management of and accommodating vulnerable workers. Then there's COVID-19 workplace access control. Then there's dealing with the worker who reports with symptoms at work or prior to work, and also the COVID case evacuation. There's the return to work assessment of somebody who was ill outside the workplace. There's the ventilation requirements. There's the hand washing and sanitizer returning back to our pre-COVID requirements, which really should fit the bill for now. There is the discussion we had on routine masks, on the allowance of masks, on the requirement of masks. There's the use of a surgical mask, perhaps in somebody returning after having been infected. There's the COVID communication, there's the case management, and then there's very important, the monitoring and supervision, which probably could be allocated back to somebody in, for instance, the position of a supervisor under Section 8.2i. And then lastly, there's the workers' duties in respect of COVID, which I just want to reiterate what those duties are. And those are not my opinion or Bulelwa's opinion. These are the duties that combine from the Occupational Health and Safety Act, from the Hazardous Biological Agents regulations, and from the Code of Practice. And it's one, every employee must comply with the employer's COVID risk assessment and COVID plan and COVID rules. Number two, an employee must report her vaccination status. An employee must report COVID-19 symptoms and must test where those COVID-19 symptoms are in place. Number four, an employee must isolate if symptomatic and positive. And number five is an employee must vaccinate if this is a requirement in the employer's risk assessment. Ashraf.
Thank you very much for that, Doc Bulelwa. You've actually covered quite a few questions that have also come up in the question and answer box. So just to the audience, I will be scanning your questions later and just moving them on where they have already been answered live. So I don't know if you want to add anything onto that, Bulelwa. But there is also a particular question that's it's slightly off the topic. If I can put it to you from Joe Benjamin, Bulelwa, when is the new Occupational Health and Safety Bill expected to be promulgated? And I'm not sure if it is any direct link to dealing with building capacity around biological hazards and potentially probably lots of other non-biological hazards. Bulelwa, just quickly on Joe Benjamin's question, over to you, 30 seconds.
I'm going to answer like a politician.
Go ahead. Well, look, I mean, our purpose today is to just inform our workplace people.
Time frame.
Go ahead.
I can.
Are you unmuted? It says unmute.
How long the council will take? I am unmute. You didn't hear me? Can you hear me?
Yes, go ahead.
No, I was saying I'm going to answer like a politician. I can't give a definite time frame. Yes, it went out for public comments last year. The council is going through all the comments because they first had to be consolidated. So the comments are being incorporated in the draft bill that was out for public comments. And should follow internal processes, then Parliament and so forth approved everything. So I cannot act, but be on the lookout.
Thank you very much for that. So clearly, we would have to wait for these processes to progress significantly in order for us to be able to have developments around the broader regulatory framework, including the OHS bill. Doc, could you touch on the issue of 6 certificates, you know, and also the question of 1 or 2 key points around vulnerable workers? We have approximately, I think, about 10 or so minutes left of this particular session. Doc, over to you.
Okay, I think on 6 certificates, what we're dealing with now is we're dealing with a massive inflow of non-conforming actions by clinics, by general medical practitioners, and by doctors in general. And we're seeing people coming back after 2 days with annotation of sick absence due to upper respiratory tract infection or flu, but those people have not been tested for COVID. Now, that's not correct, because the legal position, and I sound like an all LP 33 that's turning through, but the legal position is that of a notifiable condition. So a person who presents with COVID-19 symptoms, and they still are described as that sore throat, upper respiratory form of infection, coughing, fever, the typical symptoms which are clearly outlined in the protocols for the notifiable condition, that person must be tested in accordance with the NIOH protocol. The protocol hasn't been updated by the NICD since February 2022, but it still remains the same. That person must remain in isolation until the test result is available. Obviously, if the test is negative, then that person does indeed have a flu or a upper respiratory tract infection. If the test is positive, the person must isolate for 7 days, starting at the commencing of the onset of symptoms, or if the doctor prescribed it for longer. Asymptomatic persons who test positive do not have to isolate in South Africa, but the employer must actually identify whether we want people like this at the workplace, and that would be dependent on the workplace risk assessment, things like what the percentage of vulnerable employees is there, and also what the percentage of vaccination is. And then quarantine of close contacts is legally no longer required. So when an employee arrives with that kind of sick certificate, the employer's only got two choices. Either he sends the employee back again for testing, or number two, he requires the employee to stay off for 7 days in a lack of testing, Ashraf. Then you ask me, how should an employer manage COVID-19 vulnerable employees in the epidemic? There are 4 facts to consider. Number one, COVID is not gone. So we have to live with the fact, and it's going to be very difficult to one day declare it's gone. So let's live with it for the time being. Then number two is vulnerable employees they really are that center of the COVID epidemic. If there weren't vulnerable employees, this epidemic would have been totally different. Remember that 82% of all persons getting COVID are just getting a mild cold. And in that other 18%, that's where the vulnerable employees come in. And if one goes to look at the mortality, that's really where the bulk of the vulnerable employees come in. Vulnerable employees should be vaccinated and have received all their boosters, because the resulting immunity might not protect them from getting infected, but it'll certainly protect them from getting severe infection. As we know, it reduces also the mortality. And then employers should currently, unfortunately, incorporate that failure mode that I gave earlier on about doctors not conforming to the standard process into their risk assessment, which really makes it worse for vulnerable employees. So I think 5 suggested controls. 1, you must identify your vulnerable employees and score their vulnerability. That a doctor must do for every employer, so you know what is coming to work. Number 2, require, or not perhaps enforce, but really push vulnerable employees to get vaccinated. Number 3 is, where possible, apply reasonable job placement accommodation. Working from home still was the easiest one, but even an isolated work environment, perhaps the use of FFP2, and obviously, if the rest of your cohort is vaccinated or has immunity from natural infection, let's equate this, then that vulnerable employee comes to a very protected workplace. So that is an important aspect, is to get to take stock of what is your immunity at the workplace. And then lastly is, that COVID-19 plan that we had, the access restrictions, the reporting of illness, the assessment upon return after illness, that should really be strongly enforced, because that is the Ubuntu part of the protection for the vulnerable employee in the workplace. Ashraf.
Thank you very much, Dr. Lapierre. Bulewa, there are 2 components of mandatory, well, the one I'm going to put to you is on reporting, and I want to ask Doc about mandatory, or the issue of mandatory vaccination and so on, what the status of that is in terms of guiding workplaces around this. So Bulewa, for you, are there currently any mandatory reporting requirements to the Department of Employment and Labour for positive COVID cases? I mean, what is the status of that? Bulewa?
Maybe Jerry gets clarity. Do you mean to the compensation commissioner, or to the chief inspector, or to both? If it's work if the doctor determines that this is an occupational disease, then
let's look at both.
Question,
yeah, let's look at both.
Yes, then if that is the question, then in terms of section 25, then even if it's a GP that has diagnosed that, or an OMP that has diagnosed that, then that is reportable to the chief inspector. And then also for compensation purposes, that will be reportable to the compensation commissioner. So it will be mandatory in terms of both the OSH Act and the COIT Act.
Thank you very much for that. Doc, straight to you on the question of what does it mean if an employer makes COVID-19 vaccination mandatory for employees? And my sense is, based on our discussion thus far, that would be based on the risk assessment. Well, I mean, what are those implications? Doc, over to you.
Thank you, Ashraf. I think that's a very important question, and it's something that's been skimmed. And I just want to really take out my guns here. You know, the World Health Organization and the South African government shared a consensus that immunity, and mostly through vaccination, was and is and has been the way out of the misery of this pandemic. And most countries, in France, they let the restaurants enforce it. In South Africa, they let the employers enforce it. So we've really been abandoned by the people who are in charge. And thank you for giving me the opportunity for saying this. But if you look at the legal aspect, is the biological agent regulation require that an employer must require every employee exposed to a biological agent and who is not immune to that agent must be vaccinated. So there really is a direct legal duty on the employer to require employees exposed in the workplace to be vaccinated or be naturally immune. The easy one there is the ICU nursing practitioner that nurses COVID-19 severe cases. I mean, that employer must require that nursing practitioner to be vaccinated. It gets softer and softer if we get, it might still go for ShopRite's tellers who are being exposed to coughing people all the time, but it gets softer and softer when you get to office employees. But so when such an employee is identified, the requirements for mandatory vaccination that are stipulated in the code of practice must be met. I'm not going to repeat them here, but it's on the one side, the law allows an employer to require mandatory vaccination, but on the other side, the law also requires that mandatory vaccination is applied in a very specific process. And the key aspect to that is that the mandatory aspect of the vaccination is not an immediate, absolute, or exclusive condition of employment, or an enforcement where we bang the person down and inject her on the floor. It's a risk-based requirement to be vaccinated in order to perform the current work duties. So the mandate is not an absolute mandate, it's a mandate so that you can perform your duties. And if this condition cannot be met, alternative risk controls, including accommodated work conditions within reason, so it was the reasonable work accommodation, must be considered. And then, of course, an important aspect of mandatory vaccination is that once you've got your workplace vaccinated, those vulnerable employees, those people who really are to suffer from this pandemic, if it would reoccur, those people are protected by their peers at workplace. They go to a workplace which is safer than going to the spa or safer than going to the cinema. And I think that really is, to me, the major reason why employers could require vaccination is Ubuntu for those vulnerable employees. Ashraf.
Thank you very much, Doc. I must just put one more last question, which I think Bulelwa has touched on partially before, about the process of reporting non-compliance as the final question too. And then, since we are reaching the last few minutes of our panel discussion, for you to consider what are those last final key take-home messages that you have for our audience, both to you, Bulelwa and Dr. Peer. So to you, Bulelwa, in a very short space of time, it's the nature of panel discussions for us to be concise and short. What is the process of reporting non-compliance? You've touched on it briefly earlier, just to remind us. Bulelwa?
Can either be telephonically to the nearest Department of Labor office, or we can send an email, or it can be a walkthrough, a person that will go physically and report. and the person has got a right to remain anonymous, and that will not be disclosed who the complainant was. So that is the process that can be followed, or they can write directly to the chief inspector or to the director general or to the inspector general. So the easiest way is the nearest Department of Labor office, but wherever, if it's head office, the matter will be attended to.
Thank you very much. And then let's move over, and there are some more questions. However, we have run out of time, and we've allocated 45 minutes to this particular panel discussion. So just from you both, Bulewa, what is your take-home final message to our audience, you know, not just around this topic, but the importance of strengthening our occupational health and safety systems, as well as our ability to respond to biological hazards in particular? Bulewa?
Thanks, Ashraf. What I want to say, we all have a responsibility to play, because no one can do it alone. So we need to share our different expertise and also all our different resources to make sure that we support each other in strengthening occupational health and safety systems, and to make sure that everyone has got access to protection, because it is much more observe this and adhere to it, because occupational health and safety at work is now at the fundamental right. So working together as all parties concerned is of critical importance. Thank you.
Thank you very much. Brief and short. Doc, I'm going to be opportunistic here. I'm going to throw a question for your final sort of comment and take-home message. Are employers obliged to implement the code of practice, and what is the relationship with the hazardous biological agents regulations? Briefly, over to you, Doc.
Well, the code of practice is a practical risk control standard. It's a little bit like a SANS code, and compliance with a code is legally required. Because it's not law as the act, or as a softer law as the regulation, or softer law as SANS, it's only a code of practice. If an employer would deviate from the standards in that employer would have to be able to present good reasons as to why that should be. The code is applicable to every employer, including mines. The only exclusion is ships. And then the code also has got a special requirement. I think it's important for small employers with less than 20 employees, to go and have a good look at Section 13, which is a reduced requirement for those smaller employers, Ashraf. And as to the take-home message, I've got three. One is a very personal thing. I don't think this pandemic is over. I think this pandemic is still around, and I think it's prudent for us, particularly in occupational health setting, that we live with the idea that it's still around. Number two, medical legally, it's a notifiable condition, and there are a lot of requirements on that. Bulela was talking about reporting towards the Department of Labor, but I just want to remind my colleagues that the department, the reporting to the Department of Health of positive cases remains 100% in place. So if an antigen test is done on a point of care in a surgery and it's positive, it has to be reported. So as long as it's a notifiable condition, all those rules must be followed. And then number three is in labor law, as long as we're going to consider this as a work-acquired condition, that code of practice must be followed. Ashraf?
Well, at this point in time, I need to say thank you very much to our panelist, and that is Ms. Bulewa Huna, the Senior Specialist, Occupational Health and Hygiene from the Department of Employment and Labor. I am very thankful for you taking the time to be available and to prepare for this panel discussion and to participate in the lively manner we've had this discussion, the discussion. And then Dr. Jan Napier, occupational medicine doctor and independent occupational safety consultant with a specialization in social labor law. Thank you very much to you also, Dr. Napier. And in the background, there's a set of non-speaking colleagues, I call them non-speaking panelists, who've been tackling some of those questions in the question and answer box. And I see we've had lively participation from our attendees. Unfortunately, with this format, we can't get to every single question, but we will make a record of your questions. So thank you again, Bulelwa. Thank you again, Doc, for participating in this panel discussion. I have a sense that we've achieved our objective of reaching the workplaces and to be reaching those within the workplaces, employers, employees, management, supervision, health and safety representatives, shop stewards and other people active in the workplace, including the professional support people like occupational medicine practitioners and occupational health nursing practitioners who ensure that we work in safer workplaces. So we wish you well and want you to ensure that you remain safe and take care within your workplaces and contribute, as our panelists have emphasized, to strengthening the health and safety systems within the workplace and ensure that all the key role players within the workplace contribute to the ability of the workplace to be prepared when these type of biological hazards pose a risk in our different workplaces. And a key message from me, as our panel said, your risk assessment and an updated risk assessment is important to guide you through the different questions that we've tackled in today's session. Thank you very much, lady and gentlemen, and thank you very much to our audience and our attendees for attending today's webinar. Goodbye. See you in the next webinar.